President Cyril Ramaphosa has kicked off his two-day oversight visit to the Eastern Cape. The president's program will begin with a briefing from Transnet on plans to improve operational efficiencies at the Port of Ngqura. On Wednesday, Ramaphosa and the cabinet will meet Premier Oscar Mabuyane and his executive council to discuss improving service delivery. Newzroom Afrika's Sipha Kema is tracking the story for us and joins us now live. Sipha, a very good afternoon, a very busy couple of days it's going to be for political leaders, especially across the board, from local government to provincial, all the way to the ministers and the president who have landed there.
Absolutely, Vuyo. We've seen that state of busyness actually since the start of this week on Sunday, where there were several government events and also oversight visits conducted by some of the ministers who will be present tomorrow with the meeting between the presidency as well as provincial government, but of course not leaving out local government, Vuyo, as you would know that in most cases some of the issues and troubles and challenges actually stem from local government. So all the mayors from the districts, from the metros, from the local municipalities will also be present in that meeting with the president tomorrow. Now, one of the departments in the Eastern Cape that seems to have been seeing challenges, but also been at the front and center is the Department of Health. And joining me now is the MEC for Health in the Eastern Cape, Ms. Sipha. Thank you so much for joining us, MEC. I think, MEC, when we are talking about the president's visit and conducting some of the progress, trying to track the progresses, challenges by various departments, what comes to mind with the department is some of the issues regarding healthcare workers. Just here at Dorangins a few months ago, they were striking because of issues of overtime payments, but also some doctors and healthcare workers taking to the streets because of saying that they do not have jobs. What are the steps that have been taken by the department in addressing some of these critical issues?
Thank you very much for that. One, in terms of the doctors, we have managed to employ about 66 doctors. They've started in April. We have plans of having more of those. Remember, the issue of doctors does not only affect the Eastern Cape province, but it affects the whole country. Last week, he had a National Health Council with the minister where he has announced that 1,200 doctors will be employed. So we are hoping that out of that, we'll get a chunk as well as the Eastern Cape. But again, we are still working on our budget allocation as a department to see how many can we add out of the number that will be given to us by the national. In terms of that, at least we have managed to employ the 66, quite a number of specialists that we have employed, because we do have a grant that talks to the specialist. So we employed about 15 specialists last year, and this year we are planning to employ about 12 specialists, as well as 91 in total, but we'll have about 50-something nurses, specialized nurses, as well as 91 allied workers. So in total, we'll have about 91, including the specialists, the nurses, as well as the allied workers through the grant. So there will be an improvement. Of course, it's a drop in the ocean looking at the number of the people that are unemployed. So it means that the issues of unemployment are the reality, are a reality. As you can see that there were nurses that were on the street, but we are hoping that as we sit down preparing for the annual recruitment plan, we'll be able to employ a few. But we have also have there's a new hospital that will be opened by South African National Defence Force, and we have also alerted them that as the department we are training nurses. So if they need nurses, we do have a chunk, about 400 that have completed, that are finishing their ComServes, that will need to be absorbed. So those are the systems that we are putting in place. But as the department, we are looking at our annual recruitment plan and see how many can we employ on top of the number that will be given to us, because the number that has been announced by the minister is for the nurses and the doctors. So we have to look into us, to our financials as well as the department, to see how many can we employ in relation to that.
And then quickly, MEC, one of the other issues are issues of infrastructures, how some clinics have become or in a deteriorating state or even dilapidated, like such as the Colchester Clinic. What are the plans then in trying to refurbish those? Because I do understand that there was an issue regarding the budget as well last year, in the last financial year.
Yes, our budget was affected in the sense that when you plan, and then the metropolicals comes in with the court order that says you must pay, you have to look around in your budget and see where can I get that money to pay, because once there's a court order, you have no option but you have to pay. But we have put aside money from the grant that is meant for maintenance. So there's quite a number of clinics that we are going to revamp. Even where we are standing in Dora, last year we've appointed 2 contractors. Phase 1 is almost complete in terms of the fencing, because remember Dora was affected a lot with crime. But remember it's close to a township, so it was really affected. As a result, we've appointed a contractor to do the fencing. The project is almost complete. Now we are going to phase 2 that is also going to deal with the issue. Remember, we are a department that is faced with medical legals, so we are constructing a center because there's a case that we won, still awaiting, of course, an appeal judgment, where it was agreed that we do not have to pay a lump sum, but we can be able to provide a healthcare to those that have been affected by our negligence as a department. So we are establishing centers of excellence, and IDORA is part of those. So we've appointed a contractor that is going to start to construct that center of excellence. That also includes expanding the casualty of DORA, because DORA it's quite serving a huge population, because it has 2 services, one for the regional hospital as well as tertiary services. So it is really under pressure. So that is why we're expanding the casualty.
All right. Thank you so much, MEC Vuyo. That is the MEC for Health in the Eastern Cape, of course, giving us an overview. These are the questions, of course, that we are expecting. The President will be asking some of the government officials regarding some of the progress as well as the challenges that is faced by the departments, by the municipalities, as well as those major projects we've been talking about that have stalled in other departments, where the President is coming to take stock on those projects for you to see how far they are in terms of completion. For now, it's back to you in studio.
Sipha Kema, outside Doranginza Hospital, a hospital that has been plagued by all manner of problems, from being infested with cockroaches and rats to security personnel abandoning their posts to strikes by health workers. Hopefully, the presence of the President there and asking the right questions will go some way towards ensuring that such things do not happen again.